Hello everyone, here is Monir El Azzouzi from EasyMedicalDevice.com. Today I just wanted to introduce you the live session that I have made on LinkedIn recently regarding the EU MDR timeline. So the idea was mainly to explain to you the different timelines for EU MDR, the hard transition period, the soft transition period, and all some other details. And I tried also to answer some of the questions of the people on the chat that were live with me. So yeah, I hope it will be interesting for you. So let's talk about that. So the idea of today is just to explain again, because I think I haven't explained that since a long time about the transition, the timeline for EU MDR. And I will also show a bit of IVDR, but I think MDR is the most important thing. Okay, so I tried to make it full screen, but it didn't work, so let's keep it like that. So this is mainly the plan that I'm showing to everybody in terms of transition. And I wanted just to clarify some points with you here. The idea of this transition plan is the fact to say that we are dividing, if I can say, the plan in three. So you have the first part where we are actually. So actually we are maybe beginning of 2021, so around here. So you see that we are not too far from the red box, the red line. So from 2017, May 2017 until May 26, 2021, we are in a kind of a grace period. So this grace period is the fact that MDD is applicable, it's applied, but if you are MDR, then you are good. So it's not like you have to wait until this date to be MDR, you have to be MDR before. Initially, the date was May 26, 2021. Now it moved 1 year to May 26, 2020. May 26, 2020. Now it moved 1 year to 26, 2021. Okay. So now we will have a hard transition period. So mainly this is a period where some products, let's guess which products. Some products will be, it's obliged for them to be EU MDR. And there is some products that can continue to be sold on the market until a certain date. But from the 26th of May 2024, all products should be EU MDR certified. Here, if you see the timetable for IVDR, so the date is 26th of May 2022, then the same as MDR, so 26th of May 2024, and then from there, all products should be IVDR certified. Okay, so the idea here of today is just to explain to you a bit of some important things related to some products. First, all products here that are class 1 and that will continue to be class 1 after the 26th of May 2021 are having a hard transition period. So it means that by this date, there is no transition. There is no time left. You have to be EU MDR certified. Some people say okay, it's a class 1, self-certified. Nobody will be looking at that, mainly no notified body, etc., etc. But you have some competitors, you have some competent authorities, you have customers also. So as soon as something will go wrong, or as soon as somebody detect that you are not really following with the EU MDR, you can get in danger, and your company can get in danger. So then an audit can be happening within your facility, an unannounced audit. So they will not, maybe they will call you, but some of them are not calling, they are just coming, like the SWAT. And then, your company is in danger and your product also. So this is mainly the thing that even if you are class 1, please try to be EU MDR certified as soon as possible. The other thing is that if you are class 1, but you have, with MDR, you are up classified, then you have another transition period. So it's not anymore this one, it is until 2024. So it means that if you are class 1, but from May 26, 2021, your products become class 2A or class 2B or class 3 or class 1S or class 1R, etc. So all those classes other than class 1, then your product goes to a transition period until May 26, 2024. So you can continue to sell your products as a class 1 until this date. But, and we'll talk about the but after. Then you have the products that are class 3 implantables, custom-made device. This is a new category, if I can say, taken into account by the EU MDR, which means that by this date, your products has to be normally reviewed by a notified body. So a class 3 custom-made implantable has to have a notified body review. So class 2A no, class 2B no, etc. But class 3 implantables custom-made have to have that by this date. If you're also a pharmaceutical company that uses medical device, so combined products like combined medical device and drug, so you have the Article 117, and then from this date, the same, your product should now follow the EU MDR. So you have to get a statement from the notified body about, for example, your syringe, if it's a pre-filled syringe, that your syringe is really following the Annex 1 of the EU MDR, etc., etc. So you see those products. And there is another category of products, but this one is uncertain, is the Annex 16 products. So Annex 16 products is, if you go to Annex 16, there is 6 lines of type of products like contact lenses, just for coloring the eyes, some implants, but for having a body shape, it's not like for any other things. Some liposuction, some high pulse light, some brain stimulation device, etc. All those products that have no kind of medical purpose should be considered from this date also by those manufacturers and should be EU MDR, but only if the common specifications are published. And we talked about that, I think, with an episode, and Stefan Bollinger is here on the comments, but we talked about that on common specification. So you have to have those common specifications published before those products can really be considered under the EU MDR. What else? I think for the hard transition period, it's all that. Yeah, class 1R. So you know that now before surgical instruments or reusable surgical instruments were class 1. But there is a new classification that was issued by the EU MDR, which is class 1R for reprocessing, and only reusable surgical instruments are considered with this classification. So it means that if you are manufacturing a reusable surgical instrument, before you were class 1, so it was just a CE without a notified body. Now you are class 1R, so the notified body will have to review your reprocessing methodology for your device. Then you benefit also from this transition period until the 26th of May 2024. So if you are class 1 and because of MDR you become up classified, then you have a transition period until 2024 with the but that we'll talk just after. And I think it's all for the hard transition period, I think, if I remember well. Then you have the soft transition period. So if you have a product that is having a certificate, a CE certificate, like MDD or AIMDD, then you can continue to sell these products on the market here until the certificate expires. So if the certificate expires January 2023, then you can continue to sell the products as the MDD product until January 2023. So this is really important because the certificate after this date is not valid. I mean, there is no certificate anymore. So then you'll have to have an MDR certificate. But you should not start to think about it in January 2023. You should have 1 year before already some kind of strategy or already an audit plan or whatever, so that you can have the audit maybe in 2022 and have your certificate just after. Because, okay, when you call the notified body, they give 3 months or 5 months. I can't remember. We discussed that with Martin Witte on TÜV Süd, 3 to 5 months just to review and to approve that. Then there is maybe some time, like 6 months, to maybe plan an audit if possible. So you have already 9 months here. So just put 3 months more, so 1 year, just in case, because you never know what is happening here. Okay, I have some comment, but on which scope the products in class 1 will be if they are upgraded to a higher class period, meaning after May. Yes, okay. Sorry, I didn't answer the question, but on which scope the products in class 1 will be if they are upgraded? So they continue to be class 1. After May 2021, they continue to be class 1, and you have a proof that one thing, the product that we are talking about should be on the market before 26th of May 2021. If it is a class 1 and it is on the market before 26th of May 2021, so you have a declaration of conformity or registration of the products in the market, then it benefits from this transition period. But if you start to say, okay, my products will come on the market on September 2021, then immediately it should be EU MDR certified. So you don't benefit from this transition period. This transition period is only for devices that are placed on the market before the date of application. So here, if you are placing on the market after the date of application, you have to follow the EU MDR. So this is mainly the reason here. Hi, Monir and colleagues, just want a relevant soft transition period, also known as grace period. All devices manufactured under directives, must be placed on the EU market. Market should be certified. No, I think there is a misunderstanding here. Okay, I think there is a misunderstanding here. Okay, let's address this George question here. George's question is mainly if the product is placed on the market. So let's say an example. You have a class 1 product and you have it on your stock as a manufacturer or as an importer, because if you are manufacturer is located outside of Europe, as an importer or as a manufacturer, it's on your stock, and you want to sell it to your to your customers. So you start here, you can sell it, but here you cannot sell it anymore because you are not EU MDR, because you don't want you don't want to invest on that. You have maybe just, let's say, 1,000 units that are remaining, and you don't want to spend a lot of energy to make this product EU MDR. So by this date, it means that you cannot sell anymore the product. You have to destroy it. But what you can do is that the product is on your stock here, and you say, okay, let me place this product on the market. So let me send this product to a distributor or somebody that will acquire my product. So then it will not be on your control anymore. It will be on the distributor control. And then the distributor, he can continue to sell the product that is placed on the market because you moved it from your stock to the stock of the distributor. Then the distributor can continue to sell these products on the market until May 26, 2025. On May 25, 2025. So this is what is meaning by placing on the market. It has nothing to do with certification. It is just that the product is on your control. Now it moves to the control to another company, distributor or end user or hospital or whoever. Then it is considered as placed on the market. As soon as it is placed on the market, then it can be sold, even if it is not MDD, even if it is not MDR, even anything, it is on the market. So nobody can repeal that from the market just to say, oh, now your company lost their certification. So now all the products that you already placed on the market, you have to recall them. No, it's on the market, it's on the market. So, but they can be sold until May 25, 2025. So this is what is said on the provision for things. So when you hear that, don't mix that placing on the market and the date when you can finally sell these products and the date of the certification, which has nothing to do. It's completely two separated items. Okay. So as I've said, for the soft transition period, you can continue to sell the products until your certificate. So the certificate, a CE certificate, it says expiration date, January 2023. So you can continue to sell until this date. After this date, you cannot sell it anymore without an EU MDR certificate. But there is a thing that is also important, is the fact that during that period, so from the 26th of May 2021 until the 26th of May 2024, there should be no significant change. And this is something that is clearly important, because what is a significant change? And we have this podcast also with Eric Volbrecht and with Martin Witte about what is significant change from the side of a kind of a customer and from the side of a notified body. So that may be something that you can look at. But I have also created this kind of flowchart, which is coming from the MDCG 2020-3, where we can see, we can define what is a significant change or not. So the idea of this flowchart is mainly to say, okay, is there any change of the intended purpose? Yes or no? And then you go and you answer all the questions. And at the bottom, you have also the points. All this is a copy paste of the MDCG 2020-3, but in one page. Instead of having 10 pages that are with the flowchart that are cutting, I created one document, only one page, where everything is mentioned there, which I think is helping everyone. So if you have no significant change, let's come back. If you have no significant change, you can continue to sell your products until the end of your certificate. But if there is a significant change, then you have another situation. So the situation is like that. Let's make it easier. The date of application is here. The expiration of the transition period or soft transition is here. Your certificate expires here. So normally, you can continue to sell your products on the market until this date here. But suddenly, you imagine there is a change. And when you review, you say, oh, it's a significant change. Then if you know about this change and you will execute it, so you execute it, for example, here in mid-2022, then mid-2022 is your new date to be EU MDR certified. It's not anymore the expiration of your certificate. It is this date here. So it means that before you had maybe 2 years to do the transition. Now you have only 1 year. So it's why you have to make this plan with your management or whatever to say, okay, what kind of change can happen within the next 2 years? And then you make all those changes one by one, and you go through, for example, the MDCG 2020-3, and you go and you check if it is a significant change or not. If it is a significant change, then you can say, okay, the new date for application of EU MDR is here, is in the middle here. So this is something that is clearly important for you, and you have really to make this exercise with your team or with your management to understand when really the real date for having the EU MDR. And when you have this date, you count 1 year before. So here, for example, mid-2022 means that you have already to start by mid-2021 to your projects to get certified. So meaning calling your notified body, sending them the application, doing the review, having the audit, getting certificate, etc., etc. So then it is like 1 year. 1 year is really the best case. It can be more if for example, if your notified body has no resource, he didn't find an auditor to come to audit you, etc. So this is something that is also important to consider. Do not think, oh, every notified body is ready now to make my audit. No, it's not possible. So it's not like that. There is also something that is important is the fact that we have only 17, if I remember, notified bodies for EU MDR. So it means that, I mean, you have, let's say millions, but thousands of manufacturers that are coming to the 17 notified bodies. So the notified bodies don't have all the resources available to audit all of you. So it's why they will make some prioritization. And the prioritization first is their customers first, and then second will be maybe new customers that are coming, like startups. I'm helping a lot of startups, and startups are kind of in danger if they have a straight, if I can say, deadline for their audit or for their certification, because mainly, as I've said, notified bodies will take in priority their customers before to take anybody new. But yeah, this is mainly your exercise to call all of them and to check with all of them how you can go through that. And here is mainly what we discussed just before. I wanted to show you that, but so what we discussed just before is the fact that if you are starting to sell your products here, if you are planning to not place those devices on the market under EU MDR, you have to sell your products or to place your products on the market before the date of application. After that, you cannot place products on the market, but the products that you already placed on the market can continue to be sold until, as I've said, 2025. So this is something that is important to manage your stock. So it's a really management of stock. If, for example, you have a CE certificate that is ending 2023, so then it's also the same. So you have really to place products on the market before the end of this certificate so that you can apply to, products can be continue to be sold. So this is also something that you have to manage within your stocks. So as distributor, I can purchase more stock. As distributor, yes, you can purchase more stock. Yeah. On the if there is a guide, let me check quickly if I can find that for you. Okay, so there is a guide called the Blue Guide. Let me see if I can show that. Where is it? No. Yes. Yes. Okay. Let me share this one. Okay. Okay, this is the Blue Guide. The Blue Guide is a guide for implementation of the EU products. So since 2016, but it's still applicable now. Let me go through that. So if you go on the Blue Guide, here it says, for example, what means placing on the market. If I can click on page 18. 9, 15, 16, 17, 18. Okay, here you have everything about placing on the market. And here it tells you exactly what means placing on the market, who can place products on the market, what are the rules, how much, the fact that, for example, if a manufacturer has the products on his stock, it's not placed on the market. What is important is also there is a section here, I think later, maybe after, there is a section talking also about e-commerce. So it means that if your product is sold through a web platform, it is already considered to be placed on the market because people can buy it directly. So if they can purchase your products when it is on the platform, so then products are already placed on the market, so you can sell that to them, etc. If it is on your manufacturing stock, but it's not visible from anybody, then it's not placed on the market. So you have to make this connection between here. So products offered for sale by online platforms based in the EU are considered to have been placed on the Union market, regardless of who placed them on the market. So you see here that if you have a web shop, then it's already considered placed on the market. So this guide is really important if you want really to understand more about how products are placed on the market, and then to avoid to destroy a stock of products that are MDD compliant, but that you don't want to move them to MDR. Then here, the word or the vocabulary placing on the market can save you if you really understand how this is working. So as I said, placing on the market, it's also that you just move it from your stock to the stock of the distributor or whatever. Okay, for example, here, placing on the market is not considered to take place where a product is in the stock of the manufacturer or the authorized representative established in the union, or the importer, where the product is not yet made available. So you see here, you have exactly what I've said to you. If it is on your stock, it is not placed on the market. And this is something that is really important here. How can a distributor know if one MDD device is okay to distribute if the device has not? But no. As soon as it's placed on the market, there is no question of significant change anymore. So this is the thing. It is the responsibility of the manufacturer to confirm there is a significant change or not. Then, if you think the manufacturer has made a significant change to his product, for example, adding a new claim, adding a new feature, whatever, etc., without changing the declaration of conformity, without maybe getting an information to the notified body, etc., then maybe on your contract it's mentioned that any change should be reported, etc. And then you can ask them, have you made any change? Are you sure? And if you are sure they have made a change, you have to stop distributing the product, because mainly you are also responsible for what you are doing. So it means that at the end, you have to check that the product is compliant to be placed on the market. If you identify a new, if I can say, for example, during the transition period, you identify a change that seems to be really significant because maybe you understand what are significant changes and seems to be really significant. On the EU MDR, it is mentioned specifically. If there is a change that is significant, you confirm that it's not compliant, you have the right to stop distributing the product. I mean, it's not only the right, you have to stop distributing the product. So it's something that is really important here. So it's why you have to be aware of the law, and you cannot say, oh, I didn't know, etc. No, you know that as soon as there is a significant change, the product is not CE marked under MDD anymore, then you have to get an EU MDR certificate, etc., etc. So you have to have your kind of alert button to say, as soon as we see that, then it means that, then we have to stop distribution, because you are also liable per the economic operators requirements. Okay, so this is all what I had to say to you today. I will make that video available also on my YouTube channel, so don't hesitate to log in there. But if you have any questions, so don't hesitate to send me an email to my email address, so info@easymedicaldevice.com, info@easymedicaldevice.com, and I will try to help you. So I made this live because I have actually my green belt certification program, and there were some questions like that during the course. So I said to myself, okay, let's make a live quickly and then explain that to everybody. So thank you everybody for this short video, and talk to you soon then. Have a good day. Bye-bye.